This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Imagine how much your life would change if you were no longer able to perform basic movements. You couldn't dress, you couldn't groom yourself, you couldn't use the stairs or even hang onto a fork. Well, often it becomes reality for the millions of people living with rheumatoid arthritis. And joining us today to give us a better understanding are rheumatologist Dr. Ara Dekranian and Charla, who is living with rheumatoid arthritis. Now, Doctor, I want to talk to you here in just a minute about that suit that you're wearing. But Charla, first, let me ask you, what was it like when they first told you the words rheumatoid arthritis?
It was scary and fearful. The good news for me was the fact that I was diagnosed early, because I did go to my doctor when I started having unusual pain that wasn't normal for me. And when he realized that he couldn't diagnose it, didn't know what was going on, he wisely sent me to a rheumatologist. And my relationship that I have with that rheumatologist is awesome, because it has really made a huge difference in my treatment, in my attitude about my arthritis. It's given me hope.
That's wonderful. But I got to ask, what were some of your symptoms?
Well, the very first symptoms that I had were my arms were just aching. There was no relief. And I couldn't move my arms away from my body. And I couldn't do anything. You know, it's amazing how when your arms are just right tight to you, that not lifting them, I couldn't put clothes on over my head. I couldn't get in and out of the shower and wash my hair. You're just kind of limited like this. And so I knew that wasn't normal. And so that was the first symptoms that I had, which was great, because the fact that I did go in early enough that some of the other symptoms that kind of showed up later were already being watched.
So your life has changed a lot after the diagnosis, hasn't it?
It has and it hasn't. It has in the fact that I'm living with this disease, and I have to spend a lot of time making sure I'm doing what I need to be doing for my own personal care. In the fact, my relationship again with my doctor, keeping him informed on what's going on in my life and my body. And the way it hasn't changed is the fact that I still have a very full life. I'm very active.
There you go. Charla, thank you so much. I appreciate that. Doctor, tell me about this suit that you're wearing.
Absolutely. So this physical function suit actually is, it might look pretty funny, but it's not. And it's really meant to mimic some of the symptoms that patients like Charla may have living with their RA. So simple tasks like just reaching up above my head, or reaching down to tie my shoes or pick up something off the floor, or things that we take for granted, such as just writing. So I'm trying to hold this pen with my stiff fingers and trying to uncap the pen, and having a hard time doing it because of the loss of strength, and then really having to use my whole arm to write. Just help me understand a little bit better what some of my patients might be experiencing.
Okay, so how does it actually restrict your movement?
It takes a lot more time to do simple things, like just even to move, to try and walk. And so it really helps me understand that the simple everyday things that should take a couple minutes really are multiplied 2, 3, 4 times.
Okay, I guess that would lead to my next question then. What message are you trying to get across with the suit?
So the main message is to recognize that joint swelling, joint pain, joint stiffness are not necessarily parts of just normal aging or living an active lifestyle, but might be a sign of a serious medical condition like RA. So if people are experiencing some of these symptoms, it's really important they talk to their doctors, talk to their rheumatologists, and go to websites like ra.com or arthritis.org, which can help provide more information to try and get them to that earlier diagnosis.
Charla, Dr. Dekranian, thank you so much for sharing such important information with us this afternoon. Now that we have an idea of the impact that rheumatoid arthritis can have on somebody, let's toss it over to Lisa to learn more about the condition.
And Jimmy, as we just saw, rheumatoid arthritis can be a debilitating disease and one that's often misunderstood. The Arthritis Foundation reports rheumatoid arthritis affects more than 1 million Americans. Did you know there are 2.5 times as many women as there are men who are living with rheumatoid arthritis? And you may be surprised to learn that the disease can occur at any age. In fact, Experts say peak incidence occurs in those who are only in their 40s and 50s. And joining us today to help us better understand rheumatoid arthritis is Dr. James Burns with Peninsula Regional Medical Center's Occupational Health and Urgent Care. Thanks for joining us.
My pleasure.
This afternoon. Now, the thing about rheumatoid arthritis is it's often confused with osteoarthritis, but those are two different things, right?
Totally different. Yeah, osteoarthritis simply affects joints. Rheumatoid arthritis is an autoimmune disease which affects a lot more parts of the body, occurs at a younger age, and usually just is spontaneous and is lifelong.
Right. And Charlotte had mentioned that her symptoms include aching in the arms. Let's talk a little bit more about this pain. It's in the joints, right?
Yeah, well, the interesting thing is that the rheumatoid arthritis, as an autoimmune disease, actually affects and destroys joints and decreases range of motion, causes deformity, and decreases strength. And in certain cases can actually affect any joint in your body, and in severe cases, even the cervical spine, and causing neurologic defects in certain people as well.
All right, and there are some of the symptoms: loss of strength, lose range of motion, and joints lose integrity. What does that mean exactly?
The supporting structures. Because it's autoimmune, it can also affect other joints, or tendons, tendinosynovitis, and all the tendons support, and the joint capsule supports the joint and maintains its integrity. Once those are affected as well, the joint loses its integrity and becomes deformed.
And those symptoms aside, there are other symptoms that differentiate rheumatoid arthritis from osteoarthritis?
And that's what confuses a lot of people, because those symptoms will sometimes precede the joint symptoms, such as malaise, fever, and so forth. And then they'll sometimes affect the lining of the lung, the pleura, which creates pleurisy, so they're pain when they're breathing. Conjunctivitis, that's a serosal membrane of yourself as well. You can get nodules under the skin and so forth. But there's a variety of other symptoms that confuses the picture many times. And when you put it all together with the joint symptoms, appropriate testing, you can arrive at the diagnosis relatively quickly.
Right. Now, when people hear arthritis, they automatically think, I guess, it's something for older people. But you've seen RA and young people as well. When does it typically hit?
Well, for most of the time, it'll affect about 1% of the population worldwide through all ethnic groups, and can start at about age 30s to 50s. Okay, there are juvenile rheumatoid arthritis in about 20% of the cases of rheumatoid, which is a very confusing disease, and many times is confused with bacterial illnesses because the presentation is somewhat different. As I said, it affects about 1% of the entire population, and like I said again, it's worldwide, and all ethnic groups are affected.
And it's not genetic?
No, it doesn't appear to be genetic. However, it also appears to be a relatively recent diagnosis. In fact, ancient European and Asian skeletal remains haven't been shown to have any erosive symptoms at all, or findings at all, to suggest that.
So not really knowing where it comes from, there's no real risk factors?
No prevention, not really. We don't know, there are no risk factors. There's only diagnosis, and now with more advanced treatment, people are living a lot longer and a lot happier and better quality lives.
How do you test for rheumatoid arthritis?
The testing is a combination of both physical findings, complaints, symptoms, and there's a rheumatoid factor. There's another test called anti-CCP, C-reactive protein, and your CBC sometimes will show a little bit of anemia, sometimes changes in your liver function testing. Putting all that together will give you the diagnosis usually.
It's certainly not something you self-diagnose, right?
No, you can suspect, but not. And many people are right on the money with it too when they come in. So.
All right, Dr. Burns, thank you so much. And for more information from PRMC on rheumatoid arthritis, including information on arthritis support groups, go to delmarvalife.com and click on the show tab. Well, from your health on the inside to taking care of the outside, skincare is a multi-million-dollar industry. You just have to walk down the skincare aisle in your store to figure that out. But what you need may be found in your fridge. We learn what foods will make your skin glow. And the Incredible Hulk's skin used to glow green, and his superhuman strength couldn't be touched. We speak with the Hulk himself, Lou Ferrigno, to find out what he's doing on Delmarva this weekend. But first, we just learned about rheumatoid arthritis and how it can attack the joints in our body. Dr. Oz has more on how we can keep our joints healthy.
Making changes to improve your overall health can seem overwhelming, but don't lose hope. Even the smallest changes can reap large rewards. Here are some tips for optimal bone and joint health to keep your body younger. Strengthen your abdominal muscles and support your back by practicing good posture. Bring your head and neck back and breathe in to tighten your gut. Hey guys, get used to this kind of six-pack for a change. Your body will love you for it, especially your back. Second, save your back by wearing well-cushioned walking or running shoes whenever you're on your feet for long periods of time. Third, staying slim reduces your chance of joint pain. It's not too late to exercise. By beginning 5 minutes a day, increasing by 1 to 2 minutes each day, you'll soon master an hour.